Welcome. In this series, we talk with the scientists of the Dangoor Center for Personalized Medicine to get to know each other a little more closely. Really to understand what's happening in their research laboratories, what developments are expected to reach the market, and what medicine will look like in the coming years. This time, we have with us Dr. Miriam, or Miri, we're already friends, Bentwich. Dr. Miriam Bentwich is with us today from Bar-Ilan's Azrieli Faculty of Medicine in Tzfat. And she came all the way from the north to join us. She's a researcher in the field of bioethics, a multidisciplinary field that combines biomedicine, law, philosophy, public policy, and other areas as well. Her work deals with the many ethical questions raised by the new world of personalized medicine. Professor Bentwich has won international recognition for her work, including the prestigious Dan David Prize for Young Researchers. Dr. Bentwich brings with her rich research experience, which she gained during a postdoctorate at the University of Notre Dame. She was a Fulbright Fellow there, and she was also at the University of Toronto and the Hebrew University. In addition, she served as a research fellow at Tel Aviv University and Ben-Gurion University between the years of 2019 and 2020. She was a visiting researcher at the Petri Flom Institute for Biotechnology and Bioethics at Harvard Law. Very impressive. Welcome, Miri. I can call you that. We've spoken quite a bit. What you do is fascinating. So elaborate a little bit more. I read this very impressive intro, but in your own words, tell us, what is bioethics? What do you study, really?
Right. So bioethics, first of all, thanks for having me here. And it's a pleasure to be with you today. Bioethics, as you already mentioned, is indeed a multidisciplinary research field that actually asks moral or ethical questions regarding the context of biomedicine, whether in the area of research or in the area of treatment and diagnosis. Now, if I mention treatment or diagnosis and ethical questions or ethical dilemmas, I presume that possibly some of our viewers now think naturally about medical ethics. And indeed, bioethics includes medical ethics. However, it goes beyond medical ethics at least in two important ways. One is that medical ethics is an almost, I would say, age-old area of study and certainly implementation. Think about, for example, Hippocrates' oath with the moral commitments that any physician has towards his or her patients. This dates back presumably to ancient Greece. In contrast to that, when we talk about modern bioethics, this is relatively speaking a more new research field that actually began only in the early 1970s of the last century, which means that more or less we're talking about a research field that is only existing for the last 50 years. Now, one might ask himself, I know I certainly asked myself, what happened in the early 1970s that we needed such field, and why, or put it differently, why couldn't we just go along and continue with the good old familiar medical ethics that, as I said before, dates back to ancient Greece and from there onward. And I think that the answer to the question of what brought about bioethics as a research field in the early 1970s has to do with three interconnected factors. One, certainly after the Second World War, and more so from the early 1950s, and more so the 1960s, we begin to see a very fundamental scientific advancement and inventions within the biomedical research terrain that raises a lot of moral and social questions. Think, for example, about the so-called simple invention of the contraception pill. Okay, it's another medicine that a woman can take and that prevents her getting pregnant. Once we have that pill, obviously it raises questions for both society-wide. Is it okay? Is it moral to actually give such an option? On the one hand, obviously the rights of women on their body, whether they want to get pregnant or not want to get pregnant. On the other hand, is it moral to play God? Is it moral to prevent the birth of babies? What do physicians do in such context? They're the ones that are supposed to give the women the pill. What if a physician does not feel comfortable with that? What is his or her role? What should he do morally speaking? So that's one, just a quick example.
So bioethics, medical ethics, it's really the Hippocratic Oath, do no harm.
Right.
Do no harm.
Right.
And you're saying there's an additional layer. How do you define harm? And that's kind of where bioethics comes in to try to help frame that. Am I understanding that correctly?
Yes, absolutely. And I would say even more than that, because of those new biomedical or scientific inventions and revelations, things that before those inventions or revelations, we wouldn't ask ourselves as a society more questions without that inventions. To give you another example, the whole field of genetics, beginning from the discovery of obviously the double helix, the DNA, right? Okay, but once this was discovered, obviously human beings and specifically scientists, okay, wanted to see. Wait a second, if now we have the sort of the backbone of supposedly what makes us as human beings. Maybe we can modify it. Maybe we can prevent diseases. Maybe we can genetically edit a so-called defected area of the DNA. Now, on the one hand, it's really very, very promising. Think about nowadays technologies like CRISPR that Dangoor Center has a lot to do with that. On the other hand, what does it mean for us as a society that we, if you will, cut out or delete defected genes, or what we think to be defected?
Exactly, it's the definitions,
what is
right?
Who is defected? What is defected?
Exactly.
What is illness? What is being health? So these are questions that, before having the ability to to reinvent or to edit or to cut out such so-called defects, we wouldn't even think about asking those moral questions.
Makes sense. I remember this debate many years ago, and I'm sure it's a bioethical question, not with advanced, well, it is advanced technology, with the deaf community and cochlear implants, and whether there's a whole culture around the deaf community, correct? And they're saying, we're not defective. We don't need you to make us part of the hearing community. And by virtue of saying, every doctor or every parent saying we want to put a cochlear implant into our child, you're essentially saying there's something wrong. Right. So that's what you're talking about.
Yeah, absolutely. And actually, taking your lead of this interesting example, and talking about genetics, there is what we call the PGD, pre-implementation genetic diagnosis, which means that actually we can, not myself, yes, but the more
we, the scientific community,
exactly. The Dangoor Center, or actually also medical centers nowadays, can actually choose which embryos we want to reimplant in the womb of a woman that wants to give birth, so that we can prevent so-called diseases again.
Defective children, quote unquote.
Now, you mentioned the idea of deaf people and how do they conceptualize their deafness. There was an actual case in the United States where deaf parents asked the medical center there, I don't remember which city it was.
I remember reading this.
Okay. And actually asking the physicians to use this technology of PGD in order to make sure that they will give birth to
a deaf child. Yes.
Okay.
Yes.
So
fascinating. Which is a perfect example of how do you decide what's preferable, what's better, all this. So those are big. You had said there were 3 reasons that came about. So we got the first one, which is technological advances, scientific advances. What are some of the other reasons?
Right. The second reason or second factor is the social and cultural changes that our society is, it's an ongoing changes. So if you look back to the 60s and 70s, we know in the United States, for example, that the whole idea of civil liberties, Martin Luther King, the idea of equality to all races, no discrimination, and so on. This was a very important movement in the United States that changed both law and regulations, but more so, and this is where it pertains to bioethics or to the birth of bioethics, the understanding and the need to implement the need to pay attention and to make sure that individuals can really exercise their autonomy. And the idea that autonomy, or if you will, liberty, is not just about what is termed as a negative liberty, namely the idea that the state does not,
you alone.
Right, does not intervene in your...
Correct.
But also the idea, the basic idea of autonomy is the idea that an individual can actually positively exercise his or her wills, understanding of their life goals, and so on and so forth. And in the context of medicine, for example, the idea that the physician doesn't know everything, the idea that the physicians have to ask their patients, it's not a bit contrary to the traditional,
where the doctor knew best, right? It's empowering the individual to play a role in their medical choices.
Right.
And the third reason?
Right. And the third reason, which is very much interconnected to the social and cultural change, is actually not a very positive factor, but it should be mentioned, and that is the awful clinical trials, ethically speaking, that were conducted in the United States, in Europe, already after World War II. That is to say, if we thought that we learned, from the awful Nazi experiments, among other awful things that they've done. So if we thought that we learned something from the awful Nazi experimentations on prisoners in prisoner camps in Nazi Germany and so on. And even there were supposedly international codes of conduct, like Nuremberg Code. What we actually discovered already in the 1960s, and with a particular very infamous trial called the Tuskegee syphilis trials, that was
in America on African Americans. It was performed on African American men.
That was running for 40 years, mind you.
Yes, but they didn't stop it. It kept going,
for 30
right?
years,
You could say they should have figured it out, and
Yeah.
they just kept going, right?
So things like clinical trials like the Tuskegee syphilis trials that suddenly, broader public and the media came to be aware of, really put an emphasis on the idea that, with all due respect to scientists and physicians, apparently just leaving it to them to be moral enough, it's not good enough, and we actually need to regulate.
Right.
And how will we regulate? How would we know how to regulate? We need some kind of a research field that will teach us how to, which moral questions to ask, what are the boundaries, and so in many ways, bioethics as a research field really came about in a way as an answer, or at least an attempt to address those three factors: the more positive factors that I mentioned at the beginning, and also the awful clinical trials.
So essentially, bioethics is looking at some of the advances in society, some of the things that came out, and saying, you know what, the Hippocratic Oath is all fine and good, but it hands all the power over to the physicians, and we need to both make sure we keep an eye on the physicians and empower the other people who are to make their own decisions, and that's kind of the essence of the field. But how did you get into it? How did you find yourself interested in this space? Yeah. What's your background?
Yeah, well, that's a very interesting question, and thank you for asking me. Actually, I, like many bioethicists, originally I'm coming from the field of political philosophy.
You mentioned positive and negative freedom. Right. That's my background also. I thought Isaiah Berlin.
Exactly. So my dissertation was exactly about trying to criticize actually Berlin's negative and positive model or theory.
Off camera we can talk about that with Rousseau. Anyway, continue.
But anyway, so I came from political philosophy, and then, as you mentioned at the introduction portion, I went to postdoc, and in the first year I was completely still in political philosophy. Due disclosure, so I wasn't still in bioethics. But on the second year of my postdoc abroad, which means in Canada, in University of Toronto, while I was still affiliated formally with Dangoor Center for International Studies, so again, deep inside the political philosophy terrain, there was a neighboring center that was called the Center for Ethics. And I got curious. And so I went there to hear some of the lectures. It should be mentioned that, at least at the time that I was there, which was a bit, let's not disclose the exact years, but anyway.
You have wisdom.
Right. There you go. So back then, at least, the Center for Ethics at the University of Toronto was not just about bioethics. It was ethics as a broad area, but it also included at least some of the lectures. There were things that were related to bioethics, as I briefly we talked about before. And so I think this was the first time that I actually came across this field. And then I came back to Israel, and I was still, thinking, should I continue with political philosophy, or should I go to bioethics? Right? That was probably Freudian, what I just said. But anyway, I think it took me, probably maybe I'm a bit of a slow person in that respect, but it took me another...
You're a philosopher, you think.
Yeah, there you go. So it took me, I think, another 2 or 3 years and to realize that I really want to get into bioethics. And I think one of the things that really pushed me towards this field, apart from the initial acquaintance with it via the Ethics Center at the University of Toronto, was my subjective feeling or thought that actually somehow political scientists, at least in Israel, it seemed to me that the professors that taught me, and I really had a lot of admiration to them, couldn't really do anything, or they didn't have much influence on the political arena. So in a way, it seemed to me that, okay, they're writing all those nice papers and very smart papers, and somehow it's not implemented. And I wanted something, some kind of a field that my philosophy or my knowledge could actually, could be used to some good use in practice. And in that sense, bioethics was really very attractive to me as a field that really combines the philosophical or the theoretical with something that has
policy.
Right.
That makes sense.
Policy, practice,
right.
And so on.
So what do you focus on in your research in particular? It's a huge field. I could come up just like this with 20 different questions. Right. Are there particular questions you look at, or are you looking more generally?
Right. At the end, each study you have to focus on a particular a question or set of a question. But I think that I was fortunate, I was and still am fortunate enough to be really looking at very or quite versatile subjects. So just to give you off the top of my head, whether I myself as a researcher or as an advisor for my PhD student or MSc students and some MD students that we have at the Azrieli Faculty of Medicine. So again, off the top of my head, for example, on the one hand, I and together with my students and colleagues were very much into the whole terrain or area of older age, of end-of-life care, with a specific emphasis on cultural perspectives. I mentioned before that bioethics, one of the factors that actually brought the need for bioethics was the social and cultural changes. So one of the things that we increasingly is realized, certainly from the 1980s and onwards, is the importance of culture and different cultural perspective on the way that we view, for example, how do we interpret the autonomy of older people with dementia? How do caregivers coming from very different cultural backgrounds interpret it? To what extent do they implement personal autonomy of patients with dementia, which means that their capability for autonomy is actually limited, curtailed, right? So how do they go about it? And we really found very intriguing differences between different caregivers. How do physicians and nurses coming from varied cultural background in Israel, Sabras, those that immigrated from the former Soviet Unions, and those that are coming from the Arab sectors, how do they perceive and implement the communication with their patients about their end of life, namely patients that are towards their end of life? To what extent are they open with them? And again, we saw that there are even staggering differences culturally speaking. If we move on to genetics, which has to do much more to personalized medicine, which is what Dangoor Center does. So, in genetics, obviously, of course, one could think about the broad questions, as you mentioned before, such as again, the idea of what is healthy, what is illness, to what extent do we want to use the genetic knowledge and genetic tools like CRISPR to edit out defective things? To what extent do we want to use genetic tools like CRISPR or like PGD that we mentioned before in order to enhance human beings, going beyond medicine? Where do we draw the line, if at all? And let me just say that in the background we have to understand, and again going back a bit to the history of bioethics and biomedicine in that sense, the atrocities that the Nazis did in not only in terms of clinical trials that I mentioned before, but the whole notion of what is called eugenics, right? The use of
the perfect human being,
and actually using the science of genetics to create those perfect human beings and eradicate
the defective ones,
okay? Right? Whether Jews and whether Aryan, so-called Aryan Germans, but with their own diseases, right?
Or some challenges, right? Handicaps, challenges.
So against the backdrop of the awful eugenics, now that we have obviously much more advanced technology, much more advanced than what
Thank God they didn't have.
The Nazis have. And supposedly we are in societies that, or at least in Israel and the United States and most of the countries in Europe, certainly
we're kind of more advanced morally and ethically, and
yes, and more advanced in terms of individual rights. Okay, so in such countries, you could say, okay, so nobody will do something like Nazi Germany, and yet again, the question of when is it? Where should we draw the line on prevention of so-called defected human beings? What kind of society are we building when we use such tools? This question, or this moral question, is very much emphasized against the backdrop of
the horrors of the past, right. So we're very conscious and concerned because of it. One final question, and I'm going to pick up on a minor point you mentioned. You said you came back to Israel and your field you thought wasn't having a sufficient political impact, political science having a political. What brought you back to Israel?
I missed my country.
I think that's a lovely way to end it. So you came back to Israel. Barol, as we say, it was very clear, it's your country and your home. But why Bar-Ilan? Why the Azrieli Faculty of Medicine?
The Azrieli Faculty of Medicine was established a year before I joined the faculty, and they advertised a position. Actually, I think originally it was not even a faculty position. It was some kind of a research associate or something like that. And, I said, okay, I was very curious. I thought that, a new faculty of medicine is a wonderful opportunity for me as a bioethicist, as a bioethicist in her, relatively speaking, beginner.
The early stages of your career.
Of my career. And so I went to an interview. And when they saw me, Professor Michael Weingarten, rest his soul, he said, wait a second, actually we're looking for a faculty member that has to do something with ethics, medical humanities. Why not join us as a faculty member? So that I came for a second interview for that position, and that's how I came about.
And a medical school. You specifically wanted a medical school?
Right. Both my parents are physicians.
So it's personal. But I also assume they address a lot of the questions and in practical ways. Right. So it's not like you're just in some think tank somewhere. Right. You're looking at the implementation, which you mentioned is important to you.
And we have an ongoing connection with physicians, whether in the community clinics or in our affiliated hospitals. So it's the strong connection really brings up all the time a constant stream of research ideas. So yeah, definitely.
Thank you very much. It sounds like, unfortunately or fortunately, there are going to be many, many questions that you'll be grappling with into the future. And I do hope that your research, your background will help Israel and across the world bring us to the right future, to a just, moral, and ethical one as we move forward with these incredible medical advances. So thank you.
Thank you.